Do you wake up to pee once, twice, or even 3 times every night? You're not alone, but this common issue could be more than just annoying. It may signal something deeper about your health. In this video, we break down the real reasons why you wake up to pee and share 5 gentle habits to help your body rest better and reduce those midnight bathroom trips. Whether it's your bladder, hormones, or lifestyle choices, learning how and when to hydrate can make a big difference. If you're tired of broken sleep, it's time to take control. Watch until the end to learn simple steps that may help you stop waking up to pee, starting tonight. Don't forget to like, share, and subscribe for more gentle and science-based health tips for seniors. Because a full night's sleep isn't a luxury, it's your right. Have you ever had this happen to you? You wake up in the middle of the night, not because of a noise, not because of a bad dream, but simply because you have to pee. You quietly get out of bed, make your way through the dark, go to the bathroom, then try to fall back asleep. Once, twice, sometimes 3, even 4 times in a single night. And you tell yourself it's just part of getting older, so you accept it. But today, I want to ask you, just pause for a moment and really ask yourself, is it truly just age? Or is it your body whispering that something deeper might be going on? I've worked with hundreds of older adults over the years, and there's something I see again and again. Many health issues first reveal themselves through something as small as nighttime urination. A 70-year-old patient once told me he thought he was just a light sleeper. But the truth? It was his bladder that kept waking him up. And after running a few tests, we found early signs of prostate enlargement and a mild infection. He came in just in time. Now, don't get me wrong, getting up to pee at night isn't always dangerous. But it's also not always harmless. You deserve to know what's really going on inside your body. So if you're waking up multiple times every night, if your urine smells unusual, if you feel tired every morning like you didn't truly rest, stay with me until the end of this video, because in just a moment, I'll walk you through the key warning signs to watch for when it's time to talk to your doctor and when you can breathe a little easier. Remember, your nighttime sleep is when your body heals itself. Don't ignore the quiet signals. They may be telling you more than you realize. We'll continue right after this. You're not alone in this. And your body? It's listening to you more closely than you think. 1. Aging, or a warning sign. Look, I get it. When we reach our 60s or 70s, our bodies start to change in subtle ways. We don't sleep through the night like we used to. And for many people, that means waking up once during the night just to pee. You go. You come back to bed. You fall asleep again. At first, you don't think much of it. You tell yourself, it's normal. Everyone my age deals with this. And to be fair, there's some truth to that. As we age, our bodies naturally make less of the hormone that helps us hold urine overnight. That means your bladder gets more active at night, and needing to pee once around 2 or 3 a.m., that can be normal. But what if it doesn't stop at one time? What if it's 2, 3, or even more? I once had a patient, Grace, 68 years old, who came in looking completely worn out. She told me, "Doctor, I wake up 3 times every night. I can't sleep through. Every time I drift off, my bladder starts to ache again. And sometimes I barely pee at all." She thought it was just aging. But after a full evaluation, we found she had a mild infection and signs of overactive bladder, something that should never be ignored, especially in older adults. So let me say this clearly. If you've suddenly started peeing more than you used to, if you're waking up 3 or 4 times every night, if you feel pain, burning, or pressure when you pee, that's not just normal aging. That's your body sending a message worth listening to. It could be a urinary tract infection. It could be an enlarged prostate, something very common in older men. Or it might be an overactive bladder, small kidney stones, or even changes in your hormones. Now, I'm not saying this to scare you. I'm saying it to remind you. Your body, no matter how old you are, still has a language of its own. And nighttime urination is one of the ways it speaks to you. It doesn't shout. It whispers, quietly, repeatedly, waking you up at 1 a.m., 2 a.m., again and again. You can choose to ignore it, or you can choose to listen. Because sometimes a small response, like getting up to pee more than usual, is actually the first door that opens to something your body's been trying to tell you. So give your body the attention it deserves. And if something feels off, don't dismiss it. You have every right to ask questions. You have the right to get it checked. Not because you're weak, but because you understand and respect yourself. There are times when our bodies don't cry out in pain. Instead, they speak through quiet, subtle changes, like going to the bathroom more often, like feeling a burning sensation when you pee, or noticing your urine smells different. These may seem like small annoyances at night, but sometimes they're the very first signs of something much more serious, and the key is to recognize them early enough. 1. Burning or stinging when you pee. Maybe a urinary tract infection. This is one of the most common signs older adults tend to ignore. That uncomfortable burning sensation when you urinate. You might brush it off thinking it's because you didn't drink enough water, or maybe it's hot weather, or just part of getting older. But the truth is that burning could be your first warning of a urinary tract infection, or UTI. UTIs happen when bacteria enter the bladder or urinary tract. For older women, the risk is even higher after menopause due to hormonal changes. For men, it may be connected to prostate issues. Patients often describe it as a hot, stinging pain from the inside. Some try to avoid drinking water or hold in their urine just to escape the discomfort, but doing that only makes the problem worse. I once treated a 62-year-old woman who lived alone. She silently endured that burning for 2 full weeks because she felt too embarrassed to see a doctor. By the time she came in, the infection had already spread to her kidneys and required strong antibiotics. What I want you to remember is this. Never underestimate that burning feeling. It's not something to just accept. And when your body speaks up, respond with the care it's asking for, before it has to scream. 2. Cloudy or strong-smelling urine, a possible sign of infection. Sometimes your body doesn't hurt. There's no fever, no aches, no obvious discomfort, and yet it's still trying to speak to you. And one of the ways it does that is through the color and smell of your urine. If you notice that your urine looks cloudy, has a milky or murky appearance, or gives off a strong, unpleasant odor, that could be an early warning sign of a urinary tract infection. I once had a 68-year-old man come to me with what seemed like a simple question. "Doctor, my urine smells kind of strange lately, but I don't feel any pain. Should I be worried?" Thankfully, he chose not to ignore it, because even without burning or stinging, his body was still reacting to bacteria. Left untreated, that kind of infection can spread to the kidneys or lead to sudden high fevers, especially risky for older adults. Now, there are other causes for changes in urine too, like dehydration, eating salty foods, or side effects from certain medications. But if that unusual color or odor sticks around for more than a few days, don't brush it off. Your body is always trying to send you signals, even through something as simple as the look or smell of your urine. And listening early is always the best way to protect your health. 3. Blood in your urine. Could be linked to the bladder, kidneys, or even cancer. The thought of seeing blood in your urine is enough to alarm most people. But the surprising thing is, many who experience it try to downplay or ignore it. They say things like, "It's probably something I ate. Maybe I moved too much or exercised too hard. It'll pass." But here's the truth. Even if it's just a few pink streaks, even if it happens only once, blood in the urine is a red flag that should never be overlooked. I remember an older gentleman in his early 70s who came in out of curiosity more than concern. He said, "My urine looked a little pink yesterday. Not painful, probably just from the beats I had." But after some tests, we found small bladder stones and early signs of kidney abnormalities, something that could have developed into cancer if left unchecked. Painless blood in the urine can be caused by urinary tract infections, bladder or kidney stones, microscopic blood vessel damage, and most seriously, early signs of urinary tract cancers. Please, don't try to reassure yourself with guesses. When your body shows blood, that means something is injured, and the best thing you can do is to get it checked early, so you never have to live with the regret of finding it too late. 4. Urgency or leakage. It might be overactive bladder. Have you ever had this happen? You walk through the front door, and suddenly, you're rushing to the bathroom. Or maybe you're standing in the middle of a grocery store and out of nowhere that urgent need to pee hits you, fast. Sometimes you don't even make it in time, and you leak a little, even though you tried your best to hold it in. If this happens more than once, you might be dealing with something called overactive bladder, a condition that's quite common in older adults, especially women after menopause and men with prostate issues. It doesn't cause pain, but it does leave you with that constant uncomfortable urge to pee, even when your bladder isn't full. And it can seriously affect your daily routine, your sleep, and your confidence. One woman once told me, "I don't leave the house much anymore. I'm scared I won't make it to a restroom in time." And that fear kept her from seeing friends, from going on walks, from living the life she once enjoyed. The good news is, this condition is manageable. Pelvic floor exercises, dietary changes, and in some cases, medication. They can all help. But the first step is the hardest. Don't be ashamed. Don't stay silent. Because the bladder isn't the enemy. Silence is. And suffering in silence is never the solution. 5. Constant urge, but barely any flow. Could be prostate enlargement or urinary blockage. Have you ever felt like you had to pee all the time? But every time you sit down or stand at the toilet, barely a few drops come out? Or you have to push, strain, and still feel like you didn't quite empty your bladder? That kind of discomfort doesn't just interrupt your sleep. It wears you down, drains your energy, and affects your mood all day long. For older men, this could be a sign of an enlarged prostate, also known as BPH, a condition that becomes more common after age 60. As the prostate grows, it puts pressure on the urethra, making it harder for urine to pass through. The result? A weak stream, frequent stops and starts, that constant feeling of, "I'm not done yet," and multiple trips to the bathroom, day and night. In both men and women, having the urge to pee but barely passing any urine could also signal a urinary tract obstruction, possibly caused by small bladder stones, infections, or other issues affecting bladder function. I once had a patient say, "I thought I was just drinking too much water, but turns out the water goes in and barely comes back out." If you're dealing with something similar, please don't wait. Your body is trying to tell you that something's blocking its natural flow, and getting it checked early could bring back the comfort and peace you've been missing and truly deserve. 6. Waking up. More than 3 times a night for weeks. Waking up once during the night to use the bathroom. For older adults, that's often considered normal. But if you're getting up 3 or 4 times every night and it's been happening for weeks on end, that's no longer something to brush off. I once saw a woman in her 70s who looked completely worn out. She told me, "I can't sleep, doctor. I barely lie down and close my eyes before I have to pee again. Some nights, I'm up 5 times. So what happens? The body doesn't get the rest it needs to recover. Your energy runs low, your memory feels fuzzy, and the risk of falling at night, that goes way up too. There are many possible causes behind this kind of nighttime waking. Overactive bladder, enlarged prostate, side effects of certain medications, kidney disease, diabetes, or even mild heart failure. Whatever the cause, waking up that often shouldn't be seen as a harmless part of aging. It disrupts your deep sleep, which is absolutely essential for healing and recovery as we get older. So if this has been your reality for weeks now, please don't ignore it. Get it checked. Find the real cause. And more importantly, Reclaim those peaceful nights your body truly needs. You might be asking, do I really need to see a doctor just because I'm waking up to pee? And the honest answer is, if it's affecting your sleep, your energy, or comes with other changes, then yes, your body is asking to be heard. So many of my patients have come to me after silently enduring it for far too long. They often say, I thought it was no big deal, so I just tried to live with it. But the hard truth is, sometimes just living with it allows the issue to get worse, and the treatment becomes more complicated and drawn out. If you're experiencing any of these signs, burning or stinging when you pee, strong smelling or cloudy urine, blood in your urine, sudden urgency or leaking, frequent urges but only passing small amounts, or waking up more than 3 times a night for several weeks, then seeing a doctor isn't a sign of weakness. It's a sign that you respect and care for yourself. The good news is, figuring out the cause doesn't have to be difficult or overwhelming. A few simple tests: a urine analysis, an abdominal ultrasound, a bladder function test, can give your doctor the information they need to help you. Most causes of nighttime urination can be treated effectively, especially if caught early. Whether it's an infection, bladder dysfunction, prostate issues, or kidney-related problems. So please, don't underestimate your sleep. You deserve restful nights, and a body that can rest and repair without being interrupted again and again. If something is waking you up night after night, let your doctor help you understand why. If anything I've said today made you pause, if it reminded you of someone you love, a parent, a partner, a friend who silently gets up every night, please don't ignore it. Share this video with them. Start the conversation. The one many of us have been too quiet about for too long. And if you've been feeling concerned but unsure what to do, don't hesitate to ask questions. Because timing matters. The right care at the right moment could be the most meaningful gift you give yourself or someone you love. I know many people wait to see a doctor until their body screams, when the pain is unbearable, when sleep is gone, or when it's almost too late. But true health care shouldn't start with fear. It should start with awareness, with paying attention to the quietest signals your body is sending, even if it's just one trip to the bathroom at 2 a.m., even if it's just a subtle change in the way your urine looks or smells. Let that be the gentle reminder that you matter, that your rest matters, and that your health is worth protecting. So if you need to, make that appointment soon. And if you found this video helpful, please give it a like, leave a comment, or subscribe to the channel. That way I can continue to walk with you through every small step you take toward better health. Because sometimes, the smallest steps we take today can lead to the biggest changes in how we live tomorrow.